Let me start off by saying although I'm chair of the committee, I cannot speak for the committee. The committee has spoken for itself. The committee has made its recommendations, nor do I speak for the government. I mean, the government will have to read the report and act accordingly. And as we've stated in our recommendations, we recommend an indefinite pause on allowing MAID for mental illness.
Do you believe that Canada will ever be ready for this expansion, and if so, on what grounds?
I think any good policy making, any good governance requires the government from time to time review its decisions. And certainly I think the government should and ought to be willing at some point into the future to reconsider this.
What's future in your eyes?
Well, that's why we've made it indefinite, because in the past we postponed it for 2 years, for 3 years, and really not much seems to have changed. As one of my colleagues said, and this was someone who's been on all 3 committees examining this issue, he said 3 times we met with the same people who said the same things and we came to the same conclusion.
I would ask you, your history is emergency medicine in a regional hospital. What do you think the government should do for people who are of indefinite suffering from heavy-duty mental illnesses?
Well,
You've seen them, you know.
Well, and one of the things I've certainly seen, and this is common in any emergency room across Canada, I would say Thunder Bay Emergency Room on any given day might see 5 to 20 people who've either attempted suicide or considering attempting suicide. And I have to say that the vast majority of people, it is unsuccessful and go on at some point later on to find happiness. The number of people who do not get better is very small. And there are certainly a lot of people out there, and people have come back to me and told me, you know, I'm glad I didn't do it.
What do you say to those people who have been wanting to access MAID for mental illness reasons exclusively, and they're getting this recommendation out today saying that indefinitely this might not be a possibility for them?
Well, nothing has changed. It wasn't allowed beforehand. We're continuing to not allow it to happen, and I would suggest they continue to seek psychiatric help. And one of the things I was impressed with on the committee were the number of psychiatrists who seemed genuinely compassionate with people like that who have had ongoing suffering and voiced their willingness to try to continue to search for ways of helping them. We had some psychiatrists, Dr. Maher, who works with an ACT team. The ACT teams look after the most hardcore psychiatric cases. And he said, believe him or not, but he said he's never had a patient that he was unable to help. And we had numerous psychiatrists that say, just being there for patients, even though they feel that nothing further can be done to help them, being there means something and means something to the patients. The other thing, let me say, and as a doctor, and this year will be my 40th year since graduation, medicines do not cure everything in life. And a lot of people turn around and find happiness in life, not because of a new medication, but because something different happens in their life. They meet a new person, they find a new job. There are other things, and certainly medications and government actions aren't the cure to every malady in this earth.
Did you hear from enough voices who support expanding MAID to people with mental health difficulties?
We certainly heard from a number of voices.
Like there is criticism that you did not hear from enough and that you stacked it on one side.
Well, we followed the rules of committees in determining who would become a witness. The way all committees work is that the members of the committees all submit names of people they'd like to appear as witnesses, and the clerks and the clerks decide an apportioned number of witnesses according to the requests of the committee members. So everybody's allocated an equal number of people to appear as witnesses. And I would like to point out that some of the senators who've been the loudest in complaining about the fact that somehow the decks were stacked actually had far more witnesses appear than some of the rest of us in the Conservative and Liberal parties.
Do you think there's a clarify sorry, can you clarify why you recommended an indefinite pause instead of letting this go to the Supreme Court of Canada as a reference question to get the top court to decide, which it may eventually do in the next couple of years?
Well, the question is ultimately who should make a decision like this. I would submit that this should be something that's left to the legislature and not to the unelected courts. I mean, this is a difficult decision involving competing moral values, moral interests, and who's better placed to make that decision? I would say it should be the elected representatives who are held accountable to the people, not the unelected courts.
Do you think it was a mistake for the federal government to go down this road in the first place and even put mental health expansion on the table to begin with?
I don't know if it was a mistake, but I think good governance involves re-examining what you've done in the past and considering the possibility that maybe you didn't get it right the first time. The same as a doctor. I mean, somebody comes in an emergency department, you do your best, you make a decision based on the presentation. It may turn out later that you were wrong or you have to change directions. I think that's an acceptable part of governance.
Has the government done harm for people who are suffering from mental illness who want to access MAID and were expecting to?
By saying this and then turning around? You know, those people who are so hardcore, who are the ones kind of at the microphone saying they want this, you know, I don't think anything would have changed had we not done this. And let me clarify, we are not making suicide illegal. Suicide in Canada is not illegal. Attempting suicide in Canada is not illegal. The question is whether the government ought to, or not only ought to, but must facilitate them committing suicide.
What does it show about the state of our healthcare system if people who are suffering from mental illness want to have MAID as an option?
That's a great question, and that was certainly one of the concerns that led to our conclusion of not extending it to mental illness, because I think there is an appreciation that across this country, and a lot of this is provincial jurisdiction, but in many parts of this country, even in downtown big cities, people don't get adequate psychiatric services. They don't get adequate access to mental health services, number one, but two, access to kind of mental services they need. So the ACT teams are the teams that kind of look after the hardest core psychiatric cases. And we had a doctor from an ACT team in Barrie saying that on average people have to wait 5 or 6 years before they get into the ACT team. And certainly one of the considerations of the government is it appropriate to offer people like that medical assistance in dying when they haven't received adequate psychiatric care to begin with. And on the same note, is there, in anybody's mental suffering, that is largely affected by your surroundings, by your socioeconomic conditions. It's affected by whether you have a house, whether you have a good job, whether you have food, your relationships with other people. And I think a compassionate government response to the suffering of those people is to address those underlying factors, those socioeconomic factors, to help them make their lives better, not to help them end their misery by taking their lives.
So now do you commit to advocating for more mental health resources, more scientific research to make sure the medical community is comfortable with this and is able to assess whether somebody can get better from a mental illness? What will you do? What will you commit today to actually advocate for these resources within your own government?
Well, we certainly need, and I think there is an appreciation even before this, that across this country there is a mental health crisis. I think certainly COVID made that a lot worse, and largely this is a provincial jurisdiction, as they provide most of the healthcare dollars, and certainly provide the actual medical services. But I think there is a general appreciation that mental health services have to be better. As to whether, I mean, ultimately, is there going to be agreement among the psychiatric community that if we provide adequate psychiatric services, we should then go on to allow medical assistance in dying is one of the treatment options for people that remains to be seen. And I do have a copy, and it was interesting, the heads of 16 of, I believe, 18 medical schools in Canada, their psychiatric programs specifically asked that medical assistance in dying not be expanded to include mental illness. So I think a lot of psychiatrists feel that there certainly is harm in allowing MAID as an option, and what message does that send to people with mental illness, people who are contemplating suicide? What message does that send to, for example, Indigenous communities? And I've worked in some of those communities which have high suicide rates, and there are people who spend their lives actively working with those people and trying to dissuade them from suicide, and then the government to turn around and say, well, actually, in some cases, we should allow assistance in dying for people with mental health. And there were people and psychiatrists from Indigenous communities who said that to our committee.
Would you be able to give a comment in French about why you're making this recommendation today?
OK, je vais essayer. Tu me demandes si je peux dire en français quelque chose que je n'ai pas dit en anglais. De fait, tout l'argument pourquoi nous avons choisi de dire non pour la question d'élargir l'accès de assistance médicale à mourir. Il y a beaucoup de raisons pour ça. Et une raison, c'est cette étude était la quatrième étude dans le même sujet. Nous avons parlé avec le même témoignage. Nous avons reçu le même témoignage et nous avons fait la même conclusion. You're cutting me off. Sorry, go ahead.
That's it. Thank you.
Thank you. Merci.